Today is what?
Today is National Overdose Awareness Day, and this day was created to help improve awareness of drug overdoses and to better understand how to prevent overdoses by helping people to seek treatment for drug addiction.
Now, do you know how many years this has been taking place?
It has been taking place. It was actually started in 2001 in Australia. So this is an international event. Today is not the day that is celebrated around the world, but doing overdose awareness began by people who were survivors of this in terms of both either having lost loved ones or having had an overdose and being resuscitated and then getting into treatment and recovery, focusing on trying to reach out to other people and to help them to understand better that there are opportunities to prevent overdoses, and that particularly now, I am sure that you are aware that our president has declared the opioid epidemic as a national health emergency, and there is a lot of attention being paid to this at this point. And so the opportunity to bring awareness to the general public as well as to family members of those who may be suffering or those who are suffering from addiction is a great opportunity.
How big a problem is are drugs in Southern Nevada?
It's a huge problem in Southern Nevada. We are ranked number one in drug poisoning deaths by the CDC, and that is primarily attributed to the use of heroin and other prescription painkillers. And here specifically in Clark County, each year over the last 5 years, there has been a continual uptick in the coroner's office reporting that heroin overdose as the cause of death.
Wow, that's shocking. I had no idea. You just gave me some knowledge. The opioid epidemic, as it's been called, how bad is the opioid situation in Southern Nevada?
It is bad here in Southern Nevada as it is across the nation. But as I said, we are ranked high. Part of the problem, or part of the opportunity for people to do is that there is street heroin that is brought in through Mexico, and so there is, for some of those, it's easier to get here on the West Coast than it might be in other parts of the country.
Now, opioids, easy for me to say. How do you deal with something that's a problem, but people may legitimately need an opioid, for pain and things like that? So how do you separate the two, I guess, is my question.
Well, there are a big piece of this epidemic started about 15 years ago when people began using opioids for chronic pain and not acute pain. So opioids are appropriately prescribed following something like dental surgery, other kinds of surgery, and intended to be for short-term use. Some people, when exposed to that, become addicted to it, and that becomes a problem. But the widespread opioid epidemic that we are in is very much related to the pharmaceutical companies about 15 years ago really marketing opioids for long-term chronic pain. And the result of that has been, as in many drugs, over a period of time you build up tolerance, so you need more, and you need more, and you need more, and it becomes less and less effective. So opioids have their place in pain management, particularly for short-term use, say following a surgery, but their use for long-term chronic pain has really contributed to this epidemic.
So is there a way to, I guess, stop the epidemic, curtail the epidemic, if you will? And if there is a way, what would you suggest?
Well, certainly educating people about the risk when they are prescribed an opioid for a specific purpose, that it needs to be short duration and that the risk of them becoming addicted to that if they misuse it in any way is certainly one piece. I think additionally, generally educating people about the epidemic, where and how do people become addicted to opioids, and helping them to be aware. The other would be to educate people on signs and symptoms of addiction so that loved ones and family members can appropriately intervene and hopefully get somebody into treatment before they die of an overdose.
As far as you know, are we doing anything in Southern Nevada for National Overdose Awareness Day?
Well, there's been a lot of media that is being paid attention to and trying to use radio and television and print media as well as social media to raise awareness of the problem.
Okay, final question. I think I already know the answer, but I have to ask it anyway, and I ask you in advance. Please do not laugh at me. If the pharmaceutical companies are the ones making opioids and other drugs, why can't they just make a drug that would make it where I don't crave opioids and other drugs?
Well, that's not a question to be laughed at, so I won't laugh at you. It's very complicated. So there are parts of the brain that would be called opioid receptors, and that's where the opioid goes in and the brain gets the relief from the opioid in terms of the central nervous system. There are what are called antagonists, which are an alternate substance like Suboxone or Subutex that people can take, or methadone, to diminish that cravings. There's also naltrexone in its long-acting form, Vivitrol, that works differently to block the receptors and so to block the cravings. So there are medications that can support that, but as in any disease, taking the medications, doing the concomitant therapy that it would be required are also necessary.
Okay, great answer. That makes sense. You explained it to me. Do you have a website? What's the website? You want to pitch the website?
I certainly can. We are AmericanAddictionCenters.com is our parent company. We have a number of facilities around the country, but here in Las Vegas we have 3 facilities: Desert Hope Treatment Center, Desert Hope Outpatient Center, and Solutions Recovery.
So 3 facilities in Las Vegas.
That's correct.
I don't want to be too much in your business, as they say, but can you give me an idea of how much those facilities would cost?
It varies a lot depending upon what someone's insurance covers. We do, with the Affordable Care Act, there are a lot of people who are more covered by insurance than have previously been covered, and there's a thing called mental health and substance abuse parity, which means insurance companies have to treat this disease the same as they would any other disease, like hypertension or diabetes.
Wow, I didn't know that, really.
Yes.
That's fascinating. Can that be covered on your insurance as well?
Yes.
Okay. I'm out of questions. Did I miss anything?
No, I don't think so. You gave me a great opportunity. I appreciate it.